Well, good evening, everybody. I appreciate you all coming tonight. My name is Brennan. I'm from Seacoast Orthopedics and Sports Medicine, obviously, and just wanted to welcome you today about this lecture on sports concussions. There are definitely a lot of different types of concussions, and we're going to focus really on sports concussions. There are concussions, obviously, from car accidents, from falls, from heights. Military, we see a lot of explosive device type things, unfortunately, and they are different. They are treated differently. So we're really going to focus on sports concussions today. What are the common symptoms? How do we manage it? What you all should be concerned about or not concerned about. And I'm going to give you a case and then some videos to really kind of answer some of the common questions that we get. Because we get a lot of people who have common questions that come in the office with their kids who their son or daughter had a concussion, and they have a lot of the same standard questions, and we're going to go through that. And I think by the end of the lecture, you're going to get a good appreciation of what a sports concussion is, what it is not, and then how to handle it if you have someone, one of your athletes or one of your friends or something that you can give some advice about, yes, this needs further advice, further recommendations, further treatment. So let me start off with a case, because these are always good to start off with cases, and it can be someone you might be able to relate to. So this is a 16-year-old football player. He is a receiver. He went out for a pass, and literally, per the people who saw, he got flattened out. He really just got hit so hard that he got flattened by the defensive player. He was down on the field for about 5 minutes, but never lost consciousness, but he was down on the field. He was removed by the athletic training staff, who took him out, evaluated him, and after 20 minutes or so, he felt pretty good. He denied any headaches, didn't feel real dizzy. He actually felt like he wanted to go back in. Well, the athletic trainer said, no, you can't go back in. You had a concussion and you're not allowed to go back in. So the athletic trainer then got taken away by another injured athlete, and the coach came up to the kid, hey, you ready to go back in? And the kid's like, yeah, I'm ready. So he puts his helmet back on, and off he goes back into the game. It wasn't the coach's fault. He thought the kid was cleared, although he should have probably checked with the athletic trainer to get the final clearance. And any athlete's going to, if he can, put himself back in the game. After 2 plays and a couple of bumps, nothing major, he pulled himself out because he got a really bad headache, felt nauseous, and actually pulled himself out of the game and said, I can't go. He's in my office or somebody else's office the next day, and the parents are with him, and parents have a lot of questions. But the dad said, hey, I was actually taking video, and I'm going to show you what happened. And so I'll show you a little clip. It's not the actual, this is a formulated case, but a true story, but not the exact athlete. But let me show you this little video. I'm going to show it over and over again, and you'll think you'll appreciate the impact here. So go back and show it again here a little bit. You can see him holding his head. He's down on the ground. He didn't lose consciousness, but that was a pretty vicious hit, especially for a high school. As you guys have known, in the NFL now, they've done away with that, right? And I think at a lot of levels they're saying, that's a defenseless receiver who's really just looking for the ball, and this defensive player comes in full speed and just lays him out. And this is one of the problems that we, in the olden days when I was playing, that was cool. That was a big hit. That was a big deal. That's a great play. Nowadays, it's still for players a big deal, but for everybody else in our world is like, man, you just left that kid, hung him out to dry, and that is extremely dangerous. He almost took his head off. So again, dad and mom and the athlete are in the office, and they do have a lot of questions. First of all, do you all think that was a concussion? You do? Okay. Okay. Right. That was definitely a concussion. I mean, and you have to ask, what's the definition of a concussion? Because a lot of people think a concussion is you have to lose consciousness, and that's not the case. What I try to tell the athletes when I ask them, did you ever have a concussion before, or did you get concussed? So often we'll ask them, did you get hit so hard that you either blacked out for a second, saw stars, or just went, wow, that was a wicked hit. If you did that, there's a good chance that that was a concussion. If you get hit and like, oh, that was, wow, and keep going, probably not a concussion. But the definition's a little, The official definition is a little vague, transient loss of neurologic function. Enough to you guys, well, what's transient loss of neurologic function, right? It basically means you got stunned, you got dinged, you got hit so hard that you saw stars, heard lights, or saw lights, heard bells. It's a pretty ferocious hit. For the athlete, I had met this guy, Virgil Hill, who was an Olympic champion as well as a gold medalist in Olympics and a world champion, a guy named Virgil Hill. He's about my age. He looks phenomenal, like he could still fight. And we asked him, he did give a talk on concussions, and we said, Virgil, have you ever, you're an Olympic athlete, you're a world champion, you must have had concussions. He goes, no, I never had a concussion. Like, you never had a concussion? He's like, no. He says, you never got hit so hard that you saw lights or heard ringing in your ears or, got your bell rung? He goes, oh, yeah, that happened every day, but I never got a concussion. Like, Virgil, that's a concussion. Oh, it is? And this guy was very articulate. He wasn't, unfortunately, like Muhammad Ali. This guy was very articulate, very bright guy, and he really never thought he had a concussion. He didn't think that getting your bell rung was a concussion. This happens very commonly in high school, college, other athletes. They don't think it was a concussion because, well, I didn't get knocked out. I didn't lose my memory. It doesn't matter. If you get hit hard enough, you're seeing bells, seeing lights, hearing bells go off in your head, or you just got like, wow, that was really a bad hit. Likely a concussion, okay? Should he have gone back into the game? I think everybody has a response to that, right? Probably not. Definitely not. He shouldn't have gone back. We've gotten really strict. I remember when I started doing this 20 years ago, we had high school kids where we would put them back in the game. Be just like this kid. He would get hit. He would he'd get his bell rung. He'd see some stars for a couple minutes. He'd come off the field. We'd look at him, check him out. Totally normal neurologic exam. This was all normal. He could balance. Everything was great. And 15, 20 minutes, we'd sit them out and we'd recheck them. And how do you feel? I feel great. And you look in their eyes, and there's no haziness to their eyes. They look great. And we'd say, hey, you know what? Yeah. I mean, you look great. You run up and down on the sidelines. You do some push-ups, and they have no symptoms. Yeah, you can go back in. That was very common play. So it is interesting with this whole NFL thing where the players would come back and they're suing the NFL saying, you guys knew about these concussions and forced us back into the game. And I have to argue with that because doing this for over 20 years, and we did not know these long-term effects at that time. We didn't. And we didn't send people back in the game if we thought we were going to injure them long-term like that. So to answer that question, no, he should not have got back in the game. He should never go back in the game. Now we never let these kids go back. High school, junior high school, you'll still see it happen in the pros, that they're still going in. They're getting more strict about that. You'll see star players going back in after an obvious concussion. And I started getting in a Pittsburgh game where Hines Ward got obviously concussed, and he got up and he was staggering. University of Pittsburgh has like the concussion center in the whole country, and they take care of the Steelers. He was back in the game, and like 4 or 5 plays later, I'm like, really? You guys are the concussion center of the U.S. Obvious concussion, and you don't even follow your own guidelines. This guy was back in the game. There's pressure. There's a lot of pressure from the coaches to get these kids back in, and professionals. Luckily, education's getting better, and a lot of coaches are realizing, no, that's not the right thing, and we got to keep these kids out. And that's our goal, to get that education level up. We woke him up every 2 hours to make sure he was okay. Was that the right thing to do? No. Sir? Wake him up every 2 hours to make sure he's okay? Yes? Yeah. I think about the other thing, so I don't mean to put you on the spot. It's all good. Yeah. No, you don't need to wake them up every 2 hours. Oh, no. You need to let them sleep. They need to get rest, all right? We used to do that because we were worried about their brain bleeding and swelling in the brain. They're going to go into a coma and they're not going to wake up. That has happened. If it's happened at all, it's been very, very rare in sports concussions that's ever happened. Again, car accidents, fall from a height, from a building, that's a different animal. But a sports concussion, you're not going to see that happen 99.99% of the time. So don't wake them up. Let them sleep. Let them rest. They need that. They need the rest. So this, it's our lab. No, it's not our lab, but it's somebody's lab. Not feeling too well. Mild nausea. Vomited 3 times. A lot of people ask questions about, well, what if they're vomiting? Do I need to bring them into the emergency room? Is that a bad thing? When they get concussions like this and they are nauseous, they're going to vomit. Now, if they uncontrollably vomit and they can't stop vomiting, That could be a sign that the pressure in their brain is rising, and it's more serious than a concussion. They could be bleeding or swelling in the brain. That's different. But is it uncommon for an athlete to vomit a couple times after a bad concussion? No, it's not uncommon. Do you have to rush to the emergency room after a couple times? No. They can't stop vomiting. They just keep heaving. You should bring them into the emergency room. Make sure they don't have any bleeding or swelling in the brain. That's not normal, okay? This kid had a moderate headache. He felt a bit dizzy and foggy. His vision feels off. A lot of times they'll say that their vision doesn't feel right. They just can't. They look at the horizon, and the horizon's sort of doing this a little bit, okay? He didn't sleep well. That's because he kept getting woke up every 2 hours. But a lot of times they will have sleep disturbance. And he didn't have any loss of memory at any time. He remembered everything that happened. Not pleasant memories, but memories just the same. When we looked at him, he was alert. He was oriented to person, place, and time. He knew who his name was, where he was, and what the date was. He did have sort of this vacant sort of stare, kind of a 1,000-mile stare, looking off way in the distance. His pupils were normal. His neurologic exam was totally normal. Convergence test is a test that Pittsburgh has done where you actually have someone follow your finger. If they don't wear glasses, if they wear glasses, that can be a problem because sometimes people that wear glasses don't have great convergence or contacts. But basically you start off here and you bring the finger towards the nose, and eventually it gets blurry for all of us. But most of us can get about this close without it getting blurry. If you're out here and it's blurry and you don't wear glasses or contacts and you've had a concussion, we can follow that. Check them in a week, and now it's blurry here, where when we first saw them, it was blurry here. Okay? We call it convergence test. So if someone's in question that they may have had a concussion and they're like way out here and like, yeah, it's kind of blurry, yeah, you probably had a concussion. Okay? Best testing is a balanced scoring system where basically I have them put their hands on their hips. There's a bunch of different variations. I have them close their eyes. In 20 seconds, if they start going like this, that counts as 1 error. Up to 3 is normal, but if they're like, can't keep their balance with their eyes closed, that could be a serious injury. Something else could be going on. Cerebellar testing is like doing the finger and nose testing, and basically this kid was totally normal. Okay? Dad says he doesn't look right. He had that vacant stare. Sir?
What was the BESS?
That's a balance assessment scoring system. It's basically, there's different ways you can do it. You can do it on a flat surface, and you have them balance on one leg, and you have them close their eyes. I just do one. There's like 3 different things you can do, but I just do one. And the one I do is you have them put their non-dominant foot forward like this, heel to toe, close, and have them hands on it, and they close their eyes for 20 seconds. And you count how many errors they have. Some people are not very good at that, and it's nice to have a baseline. Other people, and you'd be surprised, we've had some really good athletes at UNH that just can't do that very well. So we can't really use that test. But most people can do this with their eyes closed and just balance. But if they're like this, and they start doing this, that's an error. And up to 2 or 3, it's not abnormal. But if the person goes like this and they just can't do it, that's not normal. And that should balance testing. It's a balance scoring system. Yeah, it's a balance test. So.
What is the test they do, like if someone's got a concussion before they can go back in and play sports again?
You mean like the online sort of neurologic test that they do?
Well, my granddaughter, one that you saw with the back,
Mm-hmm.
she had a concussion playing basketball.
Mm-hmm.
And she was like 3 or 4 weeks where she could go back because she would go back and get tested, and she didn't pass the test.
Yeah, we're going to get into that, so I'm glad you asked that. Yeah, we're going to go into those sort of tests there in a second about what those are. Yeah, good. You been reading my slides? No. Yeah. I was wondering if you were reading my slides ahead of time, so I'm going to get into that question.
Okay.
So anyways, you can see that sports injuries, it's so rare that you have some sort of neurosurgical problem, in other words, bleeding in your brain or significant swelling in your brain, that I've spoken to the ERs here and the ER at Wentworth Douglas, and we talked about don't get CAT scans on every kid who has a concussion. It's a lot of radiation exposure, and it so rarely shows anything that it's really not worth the long-term risk of, because this person in their lifetime may get 3, 4, 5 more CAT scans in their lifetime. Who knows what's going to happen to them. And it's so rare that you find anything that's going to need a neurosurgeon to do any intervention. But they have a focal deficit where they can't lift one of their hands or their arms, or their face is drooping. Obviously, that's not normal, right? That could be a significant brain injury. Unsteady, they just can't get balanced. Worsening headache. worst headache they've ever had, and it's getting worse, should go to the emergency room, should get a CAT scan. We talked about the vomiting. Loss of consciousness greater than a minute. That's a little bit debatable, but most people will say, listen, if someone has been knocked out, and when someone's knocked out on the court or on a soccer field for over a minute, that seems like forever. 1 minute and you're watching someone down, you've probably all seen it. That's a long time to be down. So most of the guidelines say if you've been knocked out for a minute or longer, yeah, even though the kid looks great, you should probably get a CAT scan to make sure everything is okay. And that's still debatable. And if their mental status is changing, they're becoming confused, becoming combative. If they're not acting themselves, they start, really the parents say, something is not right. He is really, or she is really acting strange. You might want to get a CAT scan to make sure everything's okay. So the question becomes, when can Matt return to football? And Dad says, well, I think, from the old scheme, we used to use these grade 1, 2, 3 concussions. Dad says, well, I think he had a grade 2 concussion, so Doc, he's going to be out for a couple weeks, right? And he'll be back to playing. Not the way we do things anymore. We just don't do it that way. The reason we don't is because it's been found to be inaccurate. It's just not right. What we do is we follow each athlete individually. Everybody is different, and every concussion is different. So you might get a concussion, and you may have symptoms for a couple of days, and then you quickly clear, and we get you back to running and sprinting and then doing some sport-specific stuff, and you may be fine in a week or 10 days. You may get hit in the head, the exact same mechanism, same blow to the head. It may take you 3, 4, 5 weeks to get back to normal. It's like, why is that? Because everybody's different, and we don't understand all of the differences. A lot of it is where the force came from, hitting from the front, hit from the side, their hydration status, a lot of different things that we don't totally understand. So the answer to that question is no. What we do is we follow them until their symptoms are gone. They rest, strict rest. I don't mean they can't do anything. A light swim, a brisk walk is okay, but if that creates a lot of symptoms, they even have to shut that down. But if they say, I can go for a brisk walk, they hate it because they want to be active, right? They want to be doing their thing. Or they can swim and don't have worsening of their symptoms. That's actually been found recently to be a good thing. It helps in the recovery. But you don't want to have them heavy exert themselves. You don't want to have them doing a lot of text messaging, video gaming, spending hours on the telephone with their boyfriend or girlfriend. You don't want them taking an SAT, an MCAT test, graduate level testing, any of that kind of stuff, because their brain needs to recover. And if you're stressing it with homework or standardized tests, the likelihood is they're not going to do well, and it's going to delay their recovery. They need brain rest. And I will often, if not always, write a note out for the school saying that your son or daughter has had a concussion, and we recommend, I can't make them not give tests or give reduced homework or have extra time for whatever, but we recommend that. And most of the time we've been pretty lucky about people listening to those recommendations and saying, okay, so-and-so has a concussion, we get it, we'll be easy on the homework, open book exams, that type of thing. Here's the answer to your question, these online neuropsychological tests like IMPACT, CogSport. There's a bunch of different online tests that you can take. Because everybody is so different, it's preferable to get a baseline test. When you don't have a concussion and you're in a high-risk sport, football, hockey, soccer, it would be nice to get a baseline test. You take it's about 25 minutes, it's color matching, it's shapes, it's memory. It's a pretty intense test. Most people who take it, when they get done with it, when they don't have a concussion, are like, wow, that was pretty hard. That was a pretty hard test. We get a baseline test if we can. If we don't have one, you don't have one. It's just a tool. It's not the final decision maker. Okay? If you don't have a baseline impact test, I'm probably not going to give you another impact test because we don't have a baseline, and you're different than you. Everybody's different. And impact, the one that makes it's a good test, they say, well, we've got thousands of normal values for 14-year-old girl soccer players, and we know what their baseline should be. And I don't buy it. You do, but it doesn't mean that the thousands of 14-year-olds are going to be the same as your 14-year-old. So unless I have a baseline impact test on you, I'm not going to go get another one just for the heck of it, because it's going to be different. It's going to be different. So the other thing is the impact tests, we would like to get it usually when they're freshmen in high school and then when they're juniors. And if they're college players, we get it when they're freshmen in college because neurologically they're changing all the time. There's some debate that said maybe you should start at 12 or 10 with the impact testing, the baseline testing, but that's debatable. There's no hard evidence that says that's the right answer. And if your school doesn't do impact testing, it's not necessarily the gold standard. It's a tool. It's great if you have it. It may help us get you back to play, but you don't have to have it. It's just a tool. It's nice if we can do the tests baseline, and hey, I did a baseline last year, great, and you do the test and your numbers look terrible, even though you feel good, probably not ready to go back. But there are people who pass those tests and aren't fully recovered either. They can do it. They can pass the test sometimes and still not be right up here. So, not perfect. How do we know when Matt's ready to play football again? Is he at risk for another concussion? Yes, he's at risk for another concussion. Every time you have a concussion, your risk for getting another one goes up. Especially in that 30 to 90 day window after the concussion, you are definitely at higher risk for getting another one. Okay? Does it mean you're going to get another concussion? No, it doesn't mean you definitely will. But in that window, 30 to 90 days after that concussion, you are definitely at higher risk for getting another one. Say you get past that window, now you're 6 months, a year, you're still at higher risk for getting another concussion than if you had never had one before. And yes, the more concussions you have, and even what they say, subconcussive blows, repetitive, not quite a concussion, but pretty darn close, will build upon itself and potentially make you more likely. The question is, how many is too many? How do you know? Again, everybody's different. And what I usually give for athletes recommendations is this. 2 or 3 concussions in your lifetime, and you're in a contact collision athlete, probably normal. That's not too abnormal. However, you start getting into the 4, 5, 6, that's a lot of concussions. But the biggest thing is how bad were the symptoms and how long did it take to get better? So, first concussion you got, symptoms were headache, a little dizzy, didn't feel great. A week later, symptom-free, got you running, felt good, got you sprinting, felt good, went back to soccer, felt fine, full contact, no issues. Great. 10 days, you're back to normal. Second concussion, same thing, except this one took you a month to get better. All right, beware, that's sort of a warning flag. 2 years later, you get another concussion. This one takes you 3 or 4 months to get better. All right? What you're seeing here is each concussion, even though they're separated by years apart, is taking you longer to recover. And that's when you might want to really sit down with that athlete and say, listen, you've had 3, that's not a ton, but that's 3. But this last one took you 4 months to get better. 4 months, that's a long time. You're developing a pattern here. The next one could take you 6 months. The next one you might never get totally back to normal. You might have memory issues, etc. So that's when you have the parent talk and say, listen, that's a lot of concussion. I had one lady who brought her child in. That's the first time I had seen her. Concussion number 10. 14 years old, 10 concussions. The last one took her 6 months to get better. And then I'm seeing her for this next one. And I'm like, what? The last one took you 6 months? How many have you had? 10, at least. I said, you should not be in a contact collision sport. I said, thanks, never saw him again. Didn't want to hear that answer. Didn't want to hear it. Returning to school, let's talk about helmets. There will never, let me repeat this, there will never be a helmet that will completely prevent concussions in any sport, ever. And the reason that is because not all concussions are caused by direct blows to the head. All right, concussions, the helmets are designed to prevent skull fractures, and they do a great job at preventing skull fractures. They do an okay job at preventing concussions. However, you could take a really hard body blow where your head whips back, or you get hit from the side and your head spins. Your brain is spinning, it's hitting inside your skull. Guess what? You had a concussion. Did anything ever hit your head? No. Nothing hit your head. It's just your body got whipped so forcefully and your head got whipped so forcefully that you got a concussion. How do you prevent that? With a helmet? No. Didn't hit your head. Okay? So, and there are a fair percentage of concussions that are caused just by that getting hit so hard that the head gets whipped back but never hits anything. It just gets whipped. Especially the rotational things. Anytime you get hit and spin, and you guys are going to see a concussion from a hockey player, he did get hit, but he got hit in a rotational spin. Those tend to cause the most issues. Longer recovery, prolonged symptoms, not good to have one where your head gets spun around. So if you have someone that's coming to your school, or your daughter or your son, and I got a helmet that will prevent that you ever having a concussion again, don't believe it. It's not true. It's not true, because you can't prevent all concussions. All right? There are some helmets that are better. There was a Virginia Tech study that rated some football helmets, and they did give them 5, 4, 3, and 2 stars. And it was very well done, and I give Virginia Tech credit is because they were very objective, and they were very open with these helmet manufacturers. They said, listen, for the last X amount of years, can't remember how long, we've studied your helmet, and we've done impact studies. It's a school of engineering. And we're going to release this to the press tomorrow. So all these helmet companies, you're invited to get sort of an early show. And some of you guys are not going to like it. And some of you will be like, yep, I knew our helmet was the best, right? But they didn't have to do that. And there was some really gnashing of teeth with some of these, oh, that's bull, that's a lousy study, blah, blah, blah. And like, well, you know what? We were good enough to show you the results of the study before we released it to the press. So you can defend yourself if you want. But this was, everybody who looks at the study will say this was a well-done study. It was unbiased and it was good. So there are, Virginia Tech, there is a, you can go to Virginia Tech and look for a helmet study. Just Google it. And you'll see that there are some helmets that are better. It's a couple years old now, so there's some newer helmets. So there are some that are better, but no one will ever prevent 100%.
Was the helmet a football helmet?
Mm-hmm. The football helmet study, yeah, football helmet. Returning to school, it should be similar to sports. Excuse me. You should be able, you can go to school if your symptoms aren't too bad, but a lot of times they'll do just half days. If you can go to school and the teachers are really good about not giving you a lot of homework and really stressing you, that's okay. But if the kid comes home and they got a really bad headache from their first day back, and they're not feeling great, they're nauseous and a really bad headache, that's when you got to sit down with the guidance counselor and say, listen, she just went to class today, she got halfway through her math class and got a splitting headache, she can't focus. You know what? It stinks, but she should probably be out of school for a small period of time, 3 days, 5 days, we don't know, it depends how things are going. And wait till these symptoms clear. Instead of stressing your brain, trying to make her focus on the board, listening to what you're teaching, and not being able to pay attention because her head hurts. It's not doing anybody any favors. It's just making things worse. So if you're a parent and your kid gets a concussion and your kid really doesn't look right and is really struggling with homework or going to school, you should go to bat for that child, and you should go to the guidance counselor, go to them and say, listen, bad concussion, still recovering, I want to pull my son or daughter out of school for a week. Bare bones minimum homework, try to not get too far behind. We know what that does. It stinks to get behind. It's stressful to get behind in class. So maybe they can do a little trickle effect, just do the bare bone minimum at home, as opposed to a classroom where it could be, more stressful, if you will, academically. So here it is, okay? Encourage sleep, hydration, good nutrition. No alcohol, please. Doesn't help with a concussion. Manage the symptoms. They have headaches, we treat it with headache medications. They get depressed, there are times we have to treat them with depression medicine. We try not to. We try to let patients sort of manage their symptoms on their own with over-the-counter stuff. If they're not sleeping well, we try to go with something like melatonin, a natural sort of helps you sleep supplement. Benadryl can make you really sleepy. So if they're not sleeping well because of their concussion, try to go with a simple, I'm not going to give them some high-dose sleeping pill Valium. I'm not going to do that. That's not the right answer. If they have really bad headaches, I'm going to not try to do things like Percocet and Vicodin. I'm going to try to stick with Tylenol, Advil, Aleve, maybe go Tylenol number 3 with a little codeine if they're really bad. But we try to keep away from those high-strength, headache medications. But there are times where they just have severe symptoms, really bad headaches, and we might have to give them something a little stronger for a very short period of time. We'll talk about rehab afterwards. Okay? Talked about can't preventing them all. So as far as prevention, technique, that's going to be important. We're trying to educate coaches a little bit, potentially, on maybe different tackling techniques. The coaches and the officials have to have buy-in. They have to believe that they can, by teaching different techniques, they can still be as good in that sport but not be so prone to concussions, okay? Neck strengthening. There's some theories, and this has some validity to it, that, again, if you talk about the head getting whipped and causing a concussion, right? If you can do exercises that strengthen your neck muscles, especially women, because they tend to have weaker neck muscles than men, If you can strengthen the neck muscles, when you get hit and you're starting to go this way and your neck muscles kick in and decelerate the head, you're not going to get this. You're going to get this more of a slow response. And that, in theory, will slow down that brain banging up against the skull, causing all this issues with concussions. So that's the theory. There's a lot of buy-in. Dr. Cantu down in Boston, NFL guy, great guy, a friend of mine. He's a very strong believer in neck strengthening exercises to help prevent the non-blow type of concussions, and even the blow ones, but mostly the, head whipping back. Slow the head down. If you have weak neck muscles, you're going to be like a wet noodle, right? And your head's going to flop around and not going to do well. Omega-3 fatty acids, there's some stuff in the neurosurgery literature that says, like fish oil, omega-3 fatty acids. The dose, still not certain what the optimal dose is, but that it may have some recovery effect after a concussion, and there may be some prevention in taking omega-3 fatty acids. Not big studies, not real like, this is the way to go, you got to do this. But fish oil is not going to hurt you. And I usually tell these kids recovering from concussion, especially the college kids, 3 fish oil capsules a day. Okay? Is it doing anything? Don't know yet. Is it hurting them? No. If they bite it, they're not going to be happy with you because their mouth's going to taste like salmon for the rest of the day. It's not great. So tell them not to bite it. And again, don't be wowed by the new gadgets and that type of stuff. Okay? So Matt, he's symptom-free now for the last 24 hours. He did not have a baseline impact test. If you have someone who's trained in concussions, they can keep a better eye on them. But if you don't, and you just have your regular primary care doctor, they should be kind of calling and said, how do you feel today? Great. No symptoms? No. All right. So tomorrow, you're not going back to football even though you feel great. But what you can do is tomorrow you're going to go for a jog. And you're going to go for a 15-minute light jog. Don't push it real hard. And then let's see how you're doing. They feel great. Great. You felt great. Next day, you're going to do a 15-minute jog, but you're also going to do 15 30 to 40-yard sprints, full out, full speed. How do you feel? Great, I felt great today. Okay, next day, you can go back to practice. You're going to wear a yellow jersey. You're going to just do drills. No one's going to hit you. You can't hit or be hit. And then let's see how you do. How'd that go? Great. The next day, you can go full contact collision. If you have any symptoms, we need to know about it, and we need to, okay? Now, if they do have symptoms, we don't go all the way back to the end. We just say, okay, you're shut down for a day or two. Let's just leave it at that, no sprinting. And then, say on Friday, let's go ahead and try it again. Let's see if now you can do sprints without symptoms. And if they can, that's perfect. That's great. You can advance. So the bottom line, it's a very stepwise progression, especially in a contact or collision sport. You should not say, hey, I feel symptom-free. I feel great. Well, how long? For a day. All right, you're full practice tomorrow. Don't do it. You're going to have problems. Okay, you got to work it in gradually. That's all the recommendations from all the major sports medicine folks are saying that it needs to be a gradual return. Okay. Some of the things, post-concussion syndrome. Have you guys heard of post-concussion syndrome? Yeah. So what that is exactly, it's not necessarily a worse concussion in the sense that there's more damage. However, what it is that typically, most people will get over the concussion symptoms in a couple of weeks. If you're starting to go towards that 3-week, 4-week, and you're still having symptoms, that's when we sort of draw the line. Says you've got more than just a concussion in the sense that your symptoms have lasted a lot longer than the average concussion, and we call it post-concussion syndrome. Okay? It could be the headache, it could be the dizziness, it could be the inability to focus, feeling sort of foggy still. Part of it, maybe I'm still not sleeping well, I'm having terrible problems sleeping still since the concussion. That's all part of the post-concussion syndrome, okay? Second impact syndrome is a thing that happens usually in younger athletes, and it's pretty rare, thank God, is that if you are still having symptoms from a concussion and you say, I feel great, and you go back and play and you take another substantial blow to the body or the head, you could have rapid swelling of your brain, and it's at least 50, if not 75% lethal. So we don't want to scare patients, but we say, you know what? You got to be honest about your symptoms. Don't lie, because if you go back too early and you're still having headaches or difficulty focusing, and you take a second blow to the head, you could have massive swelling of your brain, and it could kill you. It's rare. Thank God it's rare, but it can happen. Okay? Depression, anxiety, suicide. You've seen a lot with the NFL players. They it's probably multifactorial, not just the head injuries that they had. There's an association between many concussions and these things, but there hasn't been proven yet to be a causation. So it's not, oh yeah, you get so many concussions that you're definitely going to get depressed and your suicide risk is going to go way up. Again, there's an association, but not necessarily a causation at this point in time with those bad things that happen, okay? How many concussions are too many? Again, don't know. I could get 100, be fine. I could get 3 and not be good, for a long time. We don't know. These things called tau proteins. These are these proteins that they've found at Boston University by doing autopsy specimens of people's brains who've had multiple concussions, have potentially committed suicide or something happened to them. And they see these special stains, they look for these proteins, and they're the same proteins that we see with Alzheimer's disease, but it's in a different location of the brain. So you don't see these things depositing in the Alzheimer's locations of the brain, but they're very similar to Alzheimer type proteins. They're abnormal deposits of protein that can mess up cognitive function in the brain. Problem is, there's no test yet, and they're working on it, that can detect if you have 5 concussions, can I do some sort of test, that MRI or scan or something that shows if I have tau proteins starting to develop in my brain? Not yet. Right now, it's just it's an autopsy. And you probably don't want to know if you have tau proteins because you wouldn't be here if we knew if you do or not. But they're trying to develop some sort of a study, a test, some sort of a dye they can give you that will deposit potentially for a short period of time, and then you can have some sort of a detection system that will say, whoa, I see tau proteins in here. You've already got a pretty good deposit of those. Maybe you shouldn't be playing X sport anymore because you've already shown signs of these abnormal proteins in your brain. Better stop now. That's the future. That's not right now. Hold off for 28. USA Boxing for years have said you get a concussion, not even if you're knocked out, but if you get a TKO, a technical knockout, you don't box for 30 days. It means you're not in the gym for 30 days. And they may be right. That may be the right answer because there's some studies that are being done that said even though you look great and you pass all the tests, there are some studies that say your brain is not functioning normally for at least 30 days after the concussion. So if more studies come out, there may be a mandatory at some point, listen, you get a concussion, sorry, you're out for 30 days, period. At minimum, even if your symptoms are gone, even if you pass all the tests. The problem with that, if that ever came down, is a lot of people are the lying is already a problem. I think you get it more dishonesty. If they know that no matter what, they're going to be out for 30 days, athletes are not going to report them. They're like, there is no way I'm going to miss a third of my season because I have this bad headache. I'm not going to do it because I know I'm going to be out for 30 days. So this could be a problem if they do that. Younger age and women, girls do seem to be at higher risk for concussions than males. All right, not just a football problem, and we've had in the community recently. All right, and I understand why. A very concerned member of the community has brought Dover High School to the public eye about football should be banned in Dover, and I get why he's doing it because he wants to protect kids, and I understand that. However, he basically has extrapolated all the NFL information about the head injuries and the long-term things of an NFL player and said, see, if you let your kid play high school football, this is going to happen to them. That's not necessarily true. These guys that go to that level, they play very high-level high school football, very high-level college football, very high-level professional football, and they've taken a lot of blows over the years. A lot more than a kid that probably isn't going to play varsity until they're a junior. They might play X amount of games if they're lucky. Yeah, they're going to have a lot of practices as well. And yes, they're at risk for concussions, but so are hockey players. And so are soccer players. So you can't really say, well, we're going to get rid of football because they have a lot of concussions in football. Well, hockey and or soccer is number 2. You better get rid of that sport too because they're getting concussions as well. So you can't just get rid of football in the sense that you're going to prevent all concussions by getting rid of football, or saying that if you let your high school kid play football, he's going to end up like an NFL player did and be, committing suicide or be depressed, or he's going to have chronic headaches, because you can't really extrapolate that information to that level, not at this point. All right, let me show you guys a couple of videos. This just shows you that, as you already know, it does happen in other sports. There we go. Oh no, it didn't do this a few minutes ago. Let me see. Oh, this is not good. So, does anybody have access to Frisbie? Yeah, actually, I took this for a test ride before I actually started, and it worked just fine. And now they won't let you guys watch the video. And this one here is a really good one. Well, oh well. No one here has Frisbie access, right? No. All right. Let me just try something real quick and see if I can trick the system. I doubt it. Just give me 1 second. I will try to plug in something here. I doubt it's going to let me do it, but we'll try. Because this is a really good. We'll try to cut and paste it in there and see if the browser will let me do it. Probably won't. They're probably going to say access denied, but I don't know why it's doing that because it didn't. It won't let me do that either. I'll try this. Wish me luck. Nope. All right. Let's go from here. So this was actually a interview that they did about soccer players, girl soccer players, and it's a really good video. And if you guys want to write that address down, it's a really good 11-minute clip on what it's like to be someone who's had a concussion, how important that sport is to them, and by taking them out of that sport, how the athlete felt, and the impact, the pressure from coaches potentially, pressure from parents, pressure on themselves that they put on themselves. And it was a very touching interview from a couple of girls that had sustained a bunch of concussions and how they felt, and some of them are no longer allowed to play soccer. And it really does tell all about what we just talked about in a very nice 11-minute video clip. So I apologize because, again, an hour ago, less than that, it would let me play it, and now it won't. So anyways, remember these couple things as we go on, that there's really no such thing as a minor concussion, and I hear that a lot, even from parents. They say, oh, I think so-and-so had a minor concussion. There really is no such thing because you really never know how bad a concussion is going to be until it's over. In other words, what might have seemed like a simple blow, not that big a deal, maybe a mild headache, if those symptoms go on, even if it's just a mild to moderate headache, and those symptoms go on for months, that's not a mild concussion. That's a bad concussion. So you can't really tell how bad a concussion is until it's over. If you say, well, it only lasted 3 or 4 days and they felt fine, I guess you could make the case that's a mild concussion. But you can't say that on day one, okay? And it's a brain injury. No matter how you look at it, it's a brain injury. There's not, that we can measure, physical damage to the brain as far as bleeding or swelling, but the technology is getting better that maybe there is microscopic damage to cells. But it really seems to be now what we know it's more of it's a sort of a neurochemical dysfunction. All those brain chemicals are basically gone haywire from the impact, and they have to get themselves sort of back into proper equilibrium, if you will, to work properly again. There's no more grading scales, so if you have someone that goes to a doctor for a concussion, and they say, oh, your kid obviously had a grade 2 concussion, he can't play for 2 weeks. They're not, and you don't blame them. This is hard. This is hard for me to keep up on all the stuff that's coming out. They're not on top of it. I had a UNH female hockey player who had a bunch of concussions. The last one took her 6 months to get better from. She was not a current UNH hockey player, female player. She was actually at Ohio State. Ohio State said, that's it. You've had 3 bad concussions. You can't play here. We're not letting you play. So she had some connections back at UNH and said, well, I'll play at UNH. And she came back and they said, well, this girl transferred me in, Dr. Brennan, from Ohio State. She's supposedly playing on the hockey team. They stopped her from playing hockey because she had so many concussions. You want this to happen? I'm like, well, let me look into this. So I talked to Ohio State, and I talked to the girl because I got permission from her first. And she said, well, I went to a sports neurologist in Detroit, and he cleared me. I said, oh, really? Do you have that? I'd love to kind of see that. And so she said, yeah. She pulls out of her backpack, and so here it is. And this thing said, per the Colorado Concussion Scale, which was back in 1995, she's cleared to play. I'm like, oh my God. I said, well, I don't want to bash your neurologist that you went to, but he's using guidelines that are 15 years old. We don't use those guidelines anymore. Those are not valid anymore. Well, he said I was cleared. No, you're not cleared. We need to talk more about this. So if you really want to go to someone who has some concussion experience to really make sure your child, your athlete, et cetera, is taken care of properly, because it is complex, or it can be complex. You know, it's not just you sit out for a week and you're back in a week. It's not like that. Okay. Never return to play. Practice the same day. Right? We're all, those of us who are athletes, former athletes, et cetera. You know, if you know you're going to sit out and a big game's coming out, and they're like, I'm not telling them. I'm not telling anybody I got a concussion. So they will lie. They will lie. Or they'll say that their symptoms are gone to get back sooner. And you have to really, encourage them to tell the truth. If you're in doubt, we just send them out. You don't take any chances. If it's at all possible that it's a concussion, you should take them out of play. Rest. It's going to take a while to get better. And if it's getting complicated, the kid, athlete, et cetera, is just not getting better and it's taken away, in this post-concussion syndrome phase, we'll often get them to rehab with either a speech therapist, occupational therapist, physical therapist. The speech folks will often work on sort of the cognitive side, helping them, giving them tools to be able to organize their thoughts better, how to take in information and process it and get it out. They'll do all these specific sort of training exercises to help that brain get back on focus again. So we often will send folks to them. Occupational therapy, they may work on balance issues and visual issues. We actually have optometrists that are trained in post-concussion vestibular, visual and balance issues, that they're trained in that. And we have one in Portsmouth we use, Amy Przinski, who is very, very good at helping with the visual problems that come with concussions sometimes, especially if they've been going on for a long time. And we do use, I use Dr. Stensley in Dover. He's a neuropsychologist. So if someone is like, well, is this just post-concussion syndrome or there's some underlying issues? Well, a fair number of athletes come with other baggage, some depression, some anxiety. We've had a couple of athletes have bipolar disorder, and they bring some other psychological issues with them, or it unmasks a psychological issue that they weren't sure that they even had. So I often will have Dr. Stensley sort of help us with the neurocognitive. Do they have ADD or ADHD? That makes it really difficult because they have concentration issues anyways. And now they get a concussion and like, well, geez, what's their ADD and what's their concussion? Sometimes I'll have Dr. Stensley sort of help me weed that out if it gets complicated. So sometimes a neuropsychologist can be very helpful with their tests are much more advanced than the online tests. I mean, they'll do a 2 or 3 hour, talk about coming out with a headache. Their tests are really brain teaser things that really make your head hurt because it's so, really stresses your brain. But it can give us a lot of information about someone's concussion and if they're getting better or they're really in trouble still. You can watch the videos on my phone. I don't think you guys want to do that. Those are some references, and there's a handout with some references of some of the major guidelines. So if you guys want to grab one of those on the way out, where some of these, the American Academy of Neurology, American Medical Society for Sports Medicine, there's a bunch of resources to go to. These are the current, up-to-date 2013 guidelines on concussions, what they are, what they're not, returning to play, that type of thing. And I think that's it. Wanted to leave time for questions, and we do. So please, if you guys experience with concussions yourselves, questions about anything, please, this is your time to ask questions. I'm sure there's got to be some question marks about should this so-and-so have gone back to play or not gone back to play. It's a tough decision sometimes. It really can be challenging. Yes?
Can you speak a little about the headbands, the impact headbands that are being advertised for like basketball and soccer players?
Yeah. The impact headbands, matter of fact, I was asked to talk about concussions at a workman's comp insurance conference. And I've never had this happen before, but given a talk very similar to this, and I had this guy in the middle of it when I mentioned that actually put his hand up and he stood up and he said, I'm so-and-so from that company. And I'm telling you, you can buy our bands and you can prevent concussions. And I was just totally floored. And he almost got taken out with a shepherd's crook. Everybody was just floored, like, really? You're doing this advertising speech in the middle? And I said, well, sir, with all due respect, you have no evidence. And the reality is that's absolutely not true. You cannot, those bands don't work. You can you can put it on the floor and put a little thing on the bottom of it, little pressure sensor, and drop a bowling ball on it, and you'll see, yeah, there's less pressure on the band or the floor underneath the band than if you didn't have the band there. Less impact. Doesn't mean you're going to have less concussions. Depends how the blow came, where it hit, how much force was in it, did it spin, did it not spin. And things don't really happen like dropping a bowling ball on a padded, band. They don't happen that way. So it's interesting, you can't extrapolate that, but they do. They say, see, drop the thing on it, less force, didn't crack the floor without the band, see, prevents concussions. No, not exactly. But they'll try to sell you that stuff. It's a big industry trying to, mouth guards. I heard the dentist that sort of had his, quote, landmark study on you wear mouth guards, you get less concussions. Hasn't been proven. The evidence is really weak. Should you wear mouth guards? Absolutely. Jaw fractures, dental injuries, absolutely wear mouth guards. Prevent concussions? It's not going to prevent concussions. No.
It's not a prevention, but a lessen the impact or lessen the mild severe.
I don't. It's hard to say. Maybe. But there really isn't really great evidence that says that's true, We really don't have that evidence. Maybe it's less of an impact, but does that necessarily, translate into less concussions? Because it can be a cumulative effect, right? Sub-threshold hits that don't cause a concussion, but they cause enough of you get enough of those sub-threshold impacts that now it's building and boom, the next one, which wasn't that big a deal, now the person's like, wow. Because they had a bunch of smaller ones. Might that reduce those? Maybe. Yeah.
Can you note that girls soccer, that girls are at a higher risk than boys? Any rationale behind why?
One theory is the weaker neck muscles, but again, not all of them are impacted in that way. They're still studying that. Are there any hormonal influences? Like with ACL injuries, they had a big thing on, certain times of the menstrual period may make you more susceptible to ACL tears, ligament tears in your knee. That's sort of gone in and out of favor. They've sort of looked at that. Well, are women more prone during a certain part of the menstrual period of concussions during that time frame? Not really any solid evidence for that. So we don't know why that is exactly, but one of the theories is the neck muscles are not in the core strength. In general, certainly women athletes that their core strength and neck strength is phenomenal, but in general, the young high school athlete, they're probably not going to be as core strength, neck strength developed as an equal, starting to get testosterone rage 14-year-old boy, right? That's already developing some muscle mass. Yeah. Yes, ma'am. The one right before here? Sure. There are some that are different from the handout. Yeah. So, sure, yeah, absolutely. So it's, we're learning more and more every day about concussions. We definitely don't have all the answers, but we're starting to learn that there's more to it than we used to think, and we really are trying to work hard with coaches to not scold coaches, but we're trying to say, it's not like when you were playing that you just shook it off and went back in and played. And there are more and more laws, that say you can't go back and play until you're cleared by a provider, healthcare provider, including New Hampshire. Also, there's become more and more mandatory training. Like in Massachusetts, they have the coaches and the student athletes, and I think the parents of the athletes have to do an online mandatory concussion awareness training. When to report it, what is a concussion, what's not. And that's being pushed at all the state levels to try to get people to do that, to do an online. And we're working in New Hampshire to try to get something like that established as well.
We do have laws on the books right now that we need to follow.
Yeah, it just got passed in the last year about an athlete should never go back to play the same day after a concussion, and that they need to be cleared by a medical provider before going back to play. Yeah.
As a classroom teacher, and I'm not a coach, by the way, I've had a number of students who have come to, I've gotten your recommendation.
Okay. You're welcome. Sure.
What I sometimes see is I of course, have a number of student athletes in my class, and I think they have symptoms of a concussion based on their change in attentiveness and ability to focus and process, but nobody else seems to think that's an issue.
Yeah.
And that's a really hard thing, because I'm the anatomy teacher, I'm not the qualified person. So I don't know how we pursue that, other than I recommend to the nurse and to their guidance and the coach that maybe we're going to get this child checked out.
No, I think that's right.
We don't really want to check out that child, even if I call the parent, oh, he's fine, he just had a back pain.
No, I mean, that's a very good point. And, we tell folks that, teachers will often pick up some of these subtle things, as will, we always will, I like to ask the parents, is, Susie or Johnny back to themselves? Are they acting like they usually do, or do they still seem off to you? And the coaches will also pick up on it sometimes too. Say, yeah, he's not quite right. He used to be very, very friendly, very cooperative, and now he's a little bit laid back and doesn't want to really interact with the other players and that type of stuff. But the parents will tell you too, no, not quite right. Still not himself or herself. Teachers can do the same thing. Yeah, he or she was a great student. Find them drifting off in class, not paying attention, being a little disruptive, or putting their head down, or whatever. So I think that feedback is great, that you bring it up to the mom or the dad and say, so-and-so has always been right in the front, paying attention, and now you're just kind of spacing off. Something happened? Are they okay? Or I heard there was a potential concussion, and what's going on with that? I mean, yeah, that's great if you would be that proactive.
It's just a denial that we get from the other side sometimes. That's the hard thing.
Yeah, it is.
A lot of medical things.
And we've also talked about, empowering some of the officials sometimes. The officials are right there at the game, and sometimes they'll see something happen, and the kid will continue to play, but they maybe have a suspicion that that kid might have had a concussion. And we're trying to talk about getting the officials empowered that, if someone gets hit really hard, they get off the bottom of the pile, or they're in a soccer, they hit the ball and they get collided and they kind of look funny, that the official has the power to say, hey, hold on, coach, let me see, bring your player over, let me see your athletic trainer. I have a suspicion that he or she sustained a concussion just then. And right now they don't really do that so much. I mean, maybe at some levels they are more proactive about that, but it'd be nice to be able to empower get the officials a training so they're not calling everything, oh, that's a concussion. Well, no, it wasn't. But also to empower them to say, listen, if you think that was a concussion, you have the ability to stop the game and have that athlete pulled out for a second and checked out. And if it's determined, no, it's not, then fine, no harm done. But if you might have just saved somebody if the kid comes off and he's like, yeah, I don't feel great, where he or she might have continued to play, unless the official pulled him off.
I have a question, and it speaks to that. Some sports, I know, the official can tell me as a coach that he thinks my student athlete needs to be taken out of the game.
Mm-hmm.
How closely do you work with the NHIA with this whole concussion piece?
Well, there are definitely, me personally, not much. I'm part of the New Hampshire Advisory Council on Sports Concussions, and as an advisory council as a whole, we do coordinate with the New Hampshire High School Association and others to try to get the information out to them and tell them where we're at with all the guidelines and keep them, try to get them to play. So we're still, working on it. We definitely work with them. All the, NCAA, everybody's very much aware of it now. It's just a matter of how do we slowly get to implement it and make it work. So it is in progress. People are very much aware what concussions are and the impact. I mean, it's got a lot of publicity, a lot of press, and it's a good thing. Yeah. So we are working at the high school level too. And the problem is, though, is really the high school level is getting a lot of attention now too, but there's concussions in the junior high school level, and those kids are kind of left out because they may go to their pediatrician and they'll say you're out for a week and go back, and it's not their fault. It's just, pediatrician doesn't know those guidelines. It's tough to keep up with them. But is a 12 or a 10 or an 8-year-old really ready to go back to play in a week or two? I don't know. Maybe some are, maybe some are not. But we don't have nearly as much information about them as we do now about the college kid, the pro kid. That's sort of, it's eventually going to catch up to that level. A lot of people are saying, Dr. Cantu, same thing, no contact football until they're 14. Flag football until then. Same thing, no hockey hitting, no hitting at all in hockey until they're 14 or other things. Ivy League, about 3 years ago, they can only have contact collision practices like 2 practices a week. They said if you limit, because a lot of blows happen in practice, we talk about games. The Ivy League said, listen, you only get, I think it's 2 practices a week, football, where you can have contact or collision. The rest of them have to be walkthroughs and less collisions with your college football players. Maybe over the 4-year career, we'll save some brains in the future. Don't know. It's a good idea. Will all the other Division I schools do that? Alabama, Georgia? That's going to take some time before they say, okay, you get 2 contact practices a week. That's it. Maybe. I mean, I think it's going to happen eventually, but it's going to take some time. Yeah.
No, I don't want you to knock general pediatricians, but if somebody at the high school level takes a blow, is it better to advise a parent to send them to a Seacoast Orthopedics rather than a general PE?
It depends, again, how much confidence you have in your pediatrician and if you think they're up to speed on it. Well,
my position, I don't. I'm not going to know the 20 doctors that are seeing kids.
Right.
Vicinity.
Well, you can ask them specifically, are you up to date on all the latest concussion stuff? And if they are honest, they'll say, well, what do you mean by all the latest stuff? Well, in the last 3 years, there's been a lot of changes. And if they say, well, no, not really, then you can say no. Well, the other thing is, if you go there and you get that, well, he looks pretty good now, I think he can go back tomorrow. Or if he looks pretty good or she looks pretty good now, probably a week. Go back in a week, I think would be safe. Then you know they're not up to date. And it's not their fault. Then you may say, well, that's good, that's the answer I wanted, good, I can get them back in a week. Or you could maybe do the right thing and say, I need to get them to somebody who does know how to progress them from symptom-free to full contact again and not take that chance. But some parents, that's what they want, like, oh, just a day, great, he's back tomorrow. And the pediatrician or whoever, family practice, whoever says that's right, it may or may not be, probably not. And again, it's not their fault. I'm a family practice doctor as well. But it takes a lot of effort to stay on top of this.
Would you put the same category to an emergency room doctor?
Yeah, they really should never clear somebody, and they know that. They're going to basically say, don't play until you're seen by your doctor. And that's the right answer, because they just, their initial triage, make sure there's not bleeding in the brain. And if everything is great, then they should refer to somebody. Wentworth Douglas and Frisbie is pretty good about, saying, listen, you can go anywhere you want. Dr. Brennan sees the majority of the sports concussions in the area. We recommend that you follow up with him, but you can go to whoever you want, because you have a primary care doc and go for it. But he does keep up on it, and so if you want that level of attention, then you should go there. But I'm not trying to promote me. I want to make sure you guys do the right thing. It's about your kids, etc. So.
Tell you that our pediatrician, our daughter's 9, she got a concussion that we didn't even realize because she was playing indoor soccer. Took a ball off the chin. She just kept playing. Then get hurt. Then the next day she was complaining of being dizzy. So we took her to see the pediatrician the following Monday. And he diagnosed her with a concussion, but didn't give us the strict rest. Said she could go back to school half days, that kind of thing. And then by the end of the week, if she wasn't feeling better, to come back in. They then sent her for a CAT scan to get her checked out. And then it was when she was at the hospital that they referred us to go see Dr. Brennan. And when we locked her down, no TV. All she did was sit on the couch. We read to her. And we did that for 2 weeks. Thankfully, one of the weeks was April vacation. We didn't miss 2 weeks of school. But after the first day, she stopped complaining as much about her vision being blurred. So by shutting her down completely, after 2 or 3 days, we saw she was getting back to herself. So then, when the 2 weeks was up, she was back playing soccer. So we, lost that first week, And we trust our pediatrician, and we had never had a concussion before, so we felt he was giving us the best advice, but you know, certainly from our experience, we're telling everybody to go straight
You don't
to
know what you don't know.
Seacoast.
You don't know what you don't know. The other thing too,
I would welcome and appreciate an email or a phone call from a teacher who was making those observations. We asked the same of the teacher she had at the time, and they didn't get much support. We got a lot of support from the nurse, though. She was great. But so I would welcome that as a parent, so I would encourage you to reach out to the parents.
And it worked out really well. I actually had a student who just wasn't right. And he was trying to come back to school. And I marched down to guidance, and he ended up going to see Dr. Brennan. And then everything was back off for quite a long time. And he didn't, it was really clear to the class that he wasn't okay. That's the case with the parent support.
That's true.
But sometimes
And I would
it
just,
doesn't.
adopt what you were saying, I would definitely put the buzz in their ear with, you know, Dr. Brennan's practice. And you go see your pediatrician, but you might also want to contact, you know, had someone put that buzz in our ear, we may have reached out sooner. But like my husband said, we lost that first week of recovery time because we just didn't have the information and we relied on the pediatrician. And, you know, and once we started doing what Dr. Brennan instructed us to do, significant turnaround.
good.
So I would just it doesn't hurt to just put the buzz out there for a parent. If it's welcome, great. If it's not, oh well.
And a lot of it, like I said, it's what you don't know. You don't know what you don't know. And I had one of the local high schools, we have one of the trainers there, and he told me we have a problem with this high school that a lot of the teachers are not really realizing the seriousness of this particular injury, and they're not really going by your recommendations. So I said, okay, several parents were saying the same thing. They're not listening to you. I said, okay. So I asked the school AD, can I come in during one of their quarterly teacher staff meetings and meet with them and talk about it? And they said, absolutely, come on in. And I think after that meeting that I sat down with all the teachers and sort of gave them, yeah, these are real, and you really do have to rest them cognitively, really back off, give them a break, and realize that they're not faking their symptoms. They really have these real symptoms, and these are the symptoms they could have. Dramatic turnaround. Yeah, really impressive. They all were like, okay, we just need someone to really tell us that we get it. And the athletic trainer at the school said, oh my God, it's so much different. The parents are coming in from that school now. It's like, oh yeah, they're reading those recommendations, and all the teachers are going by. They're really, really turned around there. So, you know, unfortunately, I can't go to every school around the state that we looked at to give them that talk. But I think once they do understand that, the importance of it, and students aren't just blowing things off or faking their symptoms, or that, yeah, it can really affect their math or their ability to pay attention, that, you know, again, they don't know what concussions can do. That's not their training. But that was really eye-opening for me, too. A lot of people say, boy, what a turnaround at that school. There's so much more attuned to what it is and taking care of their students. So.
Would you be willing to share your PowerPoint so that we could share it so I could share that with like other teachers?
Sure, absolutely, yeah. Got to figure out how we can, what do you think, guys? What's the best way to get?
Some email address.
You want to take some email addresses and we can send it? Yeah, I don't think it's too big a file to send.
My email address, or would you like?
Yeah, we can, if everyone wants to write down their email address afterwards, I can take them and forward the PowerPoint to you.
Yeah, and you can watch the videos, which are good.
Yeah.
They're good videos.
And you'll have the links.
Yeah.
When we registered, didn't we put our email on?
You may have, and I can get that from Frisbie, but they may not all be there.
Okay.
Did they?
Easier for you to just,
Yeah.
Yeah.
One of your points was waking up people every 2 hours.
Right.
And one of the things that caught my attention was the fight that took place in the Portsmouth bar. And the kid was released from the EMS and told, okay, said, I don't want service. He went home. His friends find him in the morning, obviously not there anymore. So
Right.
that was the first time I had heard, and I'm pretty up to date. I'm obviously not in your category, but I'm pretty up to date with concussions. And I was always under the assumption that semi to a severe concussion, that you should be just waking them, making sure that they're okay, and there are no major changes. And having known that, my daughter had one this summer, and that's what we did. And find out the next day she was all fine, but to let them sleep is the best way to go.
Yeah, remember, this is you make a great point.
Okay.
Rare, but this also we're talking about sports concussions. Now, you're talking to someone in a bar fight that probably got pounded in the head many times with either their fist, a bottle, got their head slammed against the floor or a wall. You know, we don't know how many blows that particular person took to the head. That's a little different, like a fall or a car accident, same thing, versus a concussion that got hit because someone collided helmets, or someone got hit and then hit their head on the mat at a gymnastics meet and they got, ooh, I don't feel good. So remember, those type of blows are very much different potentially than someone who probably got hit many times in the head with a fist, a bottle, got their head smacked against the floor, like this guy probably did, versus, again, a sports concussion. So those type of concussive blows, you know, definitely should be, you know, watched very, very closely for bleeding and swelling of the brain and stuff, because a different impact, different and or maybe multiple impacts to the head. There was that actress was up in Canada, right? That she was skiing and had a skiing injury, and then she didn't want to go to the hospital, and she had a epidural bleed, I think. Yeah, subdural epidural. Yeah, I mean, it happens. I'm not saying it never happens, but it's not common, thank God. Again, less than 2% in sports things.
Question. Student athlete, hits the ball, throws soccer.
Heads the ball, you said?
Hits the ball.
Yeah.
You know, fine, plays the rest of the game, comes in the next day to school and says, you know, Mrs. Colson, I really didn't feel it. It must have been the adrenaline going.
Mm-hmm.
But man, when I got home last night, my head hurt.
Mm-hmm.
You know, and you hate to
Right.
say, oh, go see trainer because
Mm-hmm.
now you're going to miss
Those are
the
tough.
season. But this is a kid, you know, now that I look back on her, but is that someone that I should have been like, all right, why don't you go check in with?
Yeah, I mean, those are very difficult because, you know, we all know that if you hit your head, sometimes you'll have a headache after, like, hitting the ball or whatever. And well, does that mean we get in this discussion with JD, the head trainer at UNH, well, how do you know that this headache is just because they collided heads and they get a headache and not it was a concussion and they have a headache from the concussion? And I usually go by those other symptoms, the nausea, the visual issues, the feeling off, feeling like they're in a fog. Headache by itself sometimes is difficult to tell, especially when their symptoms aren't right after the concussion, that it happened like that night. They get home, and we do have that quite a bit, that they feel okay when they leave practice, and then they start on their way home, feel a little off, and then later that night they get a really bad headache and they feel a little nauseous, and then but then if you really get into the weeds and ask them, they're like, yeah, I don't feel right. I don't really feel like I can focus. I feel a little off. And then you say, well, yeah, that blow that you took that time, which you kind of questioned was a pretty hard blow, was probably enough to cause you to have a concussion. It can be difficult sometimes when their only symptom or the predominant symptom is just a headache and it wasn't right after, it was delayed. It makes it a little tricky, but if you're ever in doubt, right, just got to assume. Just assume the worst. Same thing, if the pediatrician isn't up to it, but he says, you know what, had a concussion, and even though it seems mild, I want your kid out for 2 weeks. I mean, is that the worst thing in the world? That's definitely erring. Most kids are cleared in 2 weeks from a concussion. And if they're not, then you could go to the next level. But could they be held up maybe a little longer than they needed to? Maybe. But if they are erring on the side of being extra conservative, I never say, you know, boy, you should really get your stuff together and no concussion's better. I'd rather you be on the conservative side and say you're out for 3 weeks or 2 weeks or 4 weeks. Student athletes, coaches aren't going to like that, and they're going to probably ask, was that really the current guidelines? And they'll say, no. Yeah. But I'd rather them be on the era of being extra conservative than saying, well, 3 days, you should be great, go back in. Nah, I'm not good. No, I'm not comfortable with that. But if they're going to say 3 weeks, sorry, you're out for 3 weeks no matter what. I don't care what. And we've had some of those cases where that comes tough. Some of the high schools we take care of, they'll go to the pediatrician or their family doctor, and they'll say, you know what, you look great, and I feel great. Well, when did your symptoms go away? A couple days ago. You've been able to do stuff? Yeah, some stuff. I really feel pretty good. And they say, okay, you can go back full practice tomorrow. And they come with the note to the athletic trainers or to the athletic directors or the coaches and say, here, I got a note from my doctor clearing me to go back today. Then I get a call from the athletic trainer at the schools that we take care of, Dover somewhere for the Oyster River, et cetera, and they say, Dr. Brennan, he had a concussion like 2 days ago, and he went to his pediatrician today, and he's full practice tomorrow. I'm like, well, that's not the way we do things. You know, it's supposed to be gradual, and 2 days is really getting back quick, and you know, we don't know if they're going to get symptoms when they start running tomorrow. And it didn't even we had a baseline impact test, but this person didn't have the chance or the knowledge of that, or to do another impact test that could help us a little bit. But am I going to override them and say, you know, screw you, I'm doing it? No, I said, you know what? Watch him closely. You know, I'm not going to tell your pediatrician that he get his stuff together. He shouldn't have done that. He's a professional. You can advise the mom or dad and say, listen, really don't do things. And I had a call the other day, and they told the mom and dad, it's really not the way we do things here at such and such high school. We really want to progress them. And they basically said this to the trainer, I got a clearance note. He's playing tomorrow, period. And we're like, whoa. So I told them, don't get in the middle of it. You get a clearance note from a doctor. It's not the best optimal treatment, but just tell the parents that's not really the way we do things here. We really should get them back slowly and not just throw them into the fire tomorrow. And if they accept that, okay, we'll do it that way. Great. But if they say, no, such and such playing tomorrow, and I've got a clearance note that says that, I'm not going to be calling up the pediatrician or the parents and saying you're wrong. It is, but you know, you got to fight. You can't fight every fight, you know.
Now, the athletic director from Somersworth is affiliated with Mashbrook?
Well, we have Rehab 3, which is behind us. We don't own them.
Right.
We work with them a lot. And we have our sports medicine sort of program and team.
Because I think my granddaughter, you know, he saw her.
Right.
She did go to Mashbrook.
Right, and a lot of times I will say, listen, you can see whoever you want to see. If you want to see a concussion specialist, you can go see Dr. Brennan. If you want to go to your pediatrician, your family doctor, you can go to your family, but you need to get clearance before you come back.
Right.
Yeah.
She had to get clearance.
Right.
She was out like almost 3 weeks, but she couldn't pass.
Give out a test, yeah.
And that was basketball.
Mm. Yeah, basketball is a collision/contact sport for sure. We kind of think it's not, but it's definitely a contact sport.
When she went down right back, a big kid right in the top of her.
You got elbows flying all the time.
You could hear it.
Yeah. Oh yeah, no doubt. You guys, great questions. So I really appreciate your time. I mean, you're way past that, and I appreciate you staying. And sorry I didn't have great videos for you. I did. We should have been here at 6:05. We would have had them, but that's not the meat of the lecture. It's all the other stuff. So hopefully this helped a little bit. All right. All right. You're welcome. Sure. Thanks. You're welcome.